Hello and welcome to our annual MCPS Mental Health Awareness Week virtual resource fair. I want to thank everyone for joining us during this important discussion about mental health resources in our schools and in Montgomery County. My name is Dr. Christina Chester, and I am the Director of the Division of Psychological Services for Montgomery County Public Schools. As a school psychologist, I understand the need for mental health resources for many of our families who have students who attend our schools. Talking about mental health as a community is very important. We need to normalize this conversation in our community. We must all work to end the stigma and have open conversations about mental health in our schools, communities, and homes. Our goal is to have equitable access to mental health services for all individuals in our county, and this resource fair is a great step in helping our families and students know of the resources that are available. Today, we will hear from several county and nonprofit agencies in Montgomery County that provide mental health support in a variety of ways to our students, staff, and families. We recognize that many of you may have questions about the information that is shared, and some have already provided questions in advance. Throughout the show, you can post your questions in our YouTube chat box. Our colleagues will compile the questions so that the panelists can respond to the questions in the second section of this program. To get us started, I would like to introduce our first panelist, Rachel Larkin. Rachel is a director of Hotline Outreach and Partnerships with EveryMind. Welcome, Ms. Larkin.
Thank you so much for having me. I'm so excited to be here today.
We're glad to have you here. Can you share with us a little bit about what your agency does for the community?
Absolutely. At EveryMind, our mission is your mental wellness, and we take it really seriously. So, we serve the community from older folks. We have a veterans program. We're one of the largest providers of in-school mental health services through the Linkages program. So lots of different programs for anybody who needs to reach out. And our website's a great place to find more information, every-mind.org. But one of our bigger programs I'd like to talk about today is the 988 Hotline program. Hopefully everybody in the audience has heard of 988. It launched in July of this year. And really what it is a new way to reach the National Suicide Prevention Lifeline. But it's more than suicide now. It is for any mental health crisis, and you don't actually have to be in crisis. You can reach us by phone, text, or chat. And that's what I really want the audience to know. This is a resource for kids of all ages, for parents, for grandparents, anybody who's having a rough day. We want to be part of your coping, right? Reach out, shoot us a text, send us a chat, or talk to somebody who really cares. Our folks are really well trained. We want to listen. We're not automatically going to send somebody out to see you. More than 99% of the folks that have a conversation with us, that's all they need. And that's great. And I think more people need to take advantage of that. Take advantage of having a conversation when they're feeling badly. Because, you know, Wellness 360 and Montgomery County Public Schools really talks about how mental wellness is such an important part of your overall wellness. Like, you can't succeed if you forget that major part of yourself. So when you're, you know, starting to struggle, reach out, make a phone call, text or chat. But, you know, all the services at Everymind are there to support you and to be part of your coping continuum. So it's really good, and 988 is free, it's confidential. You can reach us from any part of the country, and we're 24/7. So a lot of us do have mental health professionals that we work with, but, you know, we wake up at 3 a.m. and we're overwhelmed with worry about the test tomorrow. Or, you know, we can't get to bed at night. Or it's Saturday afternoon and, you know, you see online that everybody's out doing something and they didn't get invited. And that causes a lot of feelings and concerns, and reach out and talk to somebody about it. The other thing that's great about what we do is, you know, you don't have to be the person concerned. You can be concerned about somebody else, and you can reach out and talk to us, be like, hey, you know, my bestie's posting these things online, and I don't really know what to say to her. You know, like, what are the right words to say? How do I support her as she's struggling through this? And we're there for you. We can help you through that. We've had lots of parents call us and be like, my child is struggling. What do I say? What do I do? And we have lots of resources that we can give you, but we can also just say, okay, let's talk about this together. What have you noticed? What are you concerned about? Here's a great time and place to, like, sit down with your child and, like, talk about it. You know, we don't diagnose, we don't, you know, we're just there for you to support you when you're having a rough time. And we just want everybody to know about it and use it, because it is such a great resource.
No, and thank you for all the information. I mean, I'm really excited to hear about, you know, the 988 number, and that the availability of it for calling, texting, and chatting. Because I know, especially for our students, you know, especially, you know, our adolescent students with cell phones, chatting and texting is like their big thing. You know, my 13-year-old never calls. So
Right.
Being able to go on there and, like, dial the number in and text is a great way, and especially because it's 24/7. And so, like you say, if you're struggling with something or something's going on and you feel the need to talk to somebody, you can have this confidential conversation with a professional that can provide assistance to you in your time of need. And especially for our families that are listening in, if they have concerns about their students and their family members, that they can call to get help. And so that's really great to hear all of this about the 988 number and the other services that Everymind provides in the county. And we're so glad, again, to have you here on the show today and to provide this information to our audience about the new 988 number that came out in July. And hopefully for our audience, because 988 is a real simple number to remember,
Yeah.
much simpler than the previous suicide prevention lifeline.
Yeah.
So we just want everyone to be aware of this great new resource for our community. So thank you again for coming on.
Thank you.
All right. So next, our Associate Superintendent of Wellbeing and Achievement, Learning and Achievement, Mr. Damon Monte Leon, has a welcome message for our event today. Let's roll that video.
This fair is the culminating event for our annual Mental Health Awareness Week. The week started on Monday and included many in-person activities and events that happened across our schools, as well as a special student forum. If you have not yet gone to the website, please take some time to check it out. At this site, www.mcpsmentalhealth.org, you can watch an array of videos and presentations about mental health topics that our district staff and partners have created for you. Students can get a total of 9 Student Service Learning, or SSL, hours by watching select videos and then completing a brief follow-up exercise. Several of the sessions are also in multiple languages. And during this program, MCPS mental health staff members are available via the YouTube chat to answer any questions you may have. And we may even answer your questions during our question and answer session during the second half of this program. I hope you enjoy meeting today's panel of mental health experts who will share valuable resources and contact information with you. You should feel free to reach out to these professionals in the future. And remember, all of our schools have school-based psychologists, social workers, and counselors who are available to provide supports to our students, staff, and families. Thank you for attending this event. Be well.
My next guest with us is Lonnie Park. Lonnie is the clinical supervisor of the Jewish Social Service Agency, or JESA. Welcome to the Resource Fair.
Well, thank you for having me.
All right, can you share with us what JESA does in order to support our students in our schools?
Absolutely, I'd be glad to. So JESA is a larger organization that provides a range of services. So you can explore those at jesa.org. We have a community mental health clinic and employment services, but in our schools, we've been excited to partner with MCPS. Currently, we're in 17 schools, and we are able to provide quick access to solution-focused brief therapy. So that means that parents can reach out to school counselors can notice a child can ask for themselves, and we'll facilitate that school counsel will facilitate that process. And our therapists are in those schools. Right now we're in a cluster in Gaithersburg, in Poolesville, and East County. We are planning to expand to more schools soon. And our therapists are trained in brief solution-focused therapy, and that means that it's a good setup for that 4 to 5 month range that it's meant to be, and really helps to kind of identify what the youth is struggling with, identify their own internal strengths, and help them build some good coping skills and feel more ready to handle what's next. And then we can also help them facilitate longer term support if that's what they need.
No, and it's great to be able to hear about the brief therapy that your clinicians are able to provide within our schools, and that, because I know with the expansion of your program, it's going to allow us to provide more support within our elementary and middle schools for this school year as well. So we're glad that you're already in the 17 of our schools, but then there's going to be additional schools for this school year as well. And so, and you talked about before, just to clarify, if a family member or a student is interested in those services, they can go and talk to staff at the school to get a referral if you're a part of that school?
Yes, absolutely. So often our referrals will come from a parent who's concerned, and they'll reach out to that school counselor, and the school counselor will be able to help them with those forms and help them connect to our therapist.
Okay.
While I'm here, I thought I'd also share a great story that one of our therapists shared with us recently. He had a new referral, and that elementary school child was really not wanting to come with this person they hadn't met. And one of his current kids that he is working with said, "It's okay, Mr. Eli is a feelings teacher. And Mr. Eli helps me be safe when I'm angry. He's going to help you be able to be safe when you're angry. It really works because now I don't throw chairs anymore."
Well,
so we are really really proud of the work that our therapists are doing, and glad they're able to do that and be there for your kids in the schools.
Well, we are very excited to have your agency in our schools and the expansion of those services as well, so that you all can get an opportunity to see even more kids who are in need of mental health support, especially after the pandemic. We know there's just so many students and their families who are in need of support, and so we're glad to be able to provide these intensive therapeutic services within our schools. So we want to thank you for coming on and joining us, and we'll see you later during the Q&A session.
Okay, great. Thank you.
All right. So now, let's watch a video welcome message from the co-presidents of the Montgomery County School Psychologists Association, Ms. Janice Campbell and Ms. Ciara Caprera. Let's watch.
Good morning. I'm Janice Campbell.
And I am Ciara Caprera. We are the co-presidents of the Montgomery County School Psychologists Association.
We're pleased to partner with MCPS on this year's Mental Health Awareness Week, including today's Mental Health Resource Fair.
Over the years, we have been able to build a library of videos about a wide range of mental health topics. On the website, you can find video presentations addressing a variety of mental health needs that reflect the rich diversity of the MCPS community.
In Montgomery County, We are fortunate to have a range of supports for students and families with mental health needs. In addition to the school counselors and school psychologists, MCPS has added social workers and Bridge to Wellness centers in the high schools. There are also a number of initiatives and community partners who provide support to our students. Check out what new supports exist in the What's New in Montgomery County section of the website. Please utilize the chat during the live stream to send in your questions. We hope you will find the information useful.
I want to thank the Montgomery County School Psychologists Association for all of their work and support to create this week-long event. We could not do this without you and all of your team members. And so my next guest is Ms. Catherine Royston, who is the Senior Program Coordinator for Our Minds Matter. Our Minds Matter is a student-led peer-to-peer club modeled and designed to change school culture around mental health. Welcome.
Thank you for having me here today.
Glad to have you here. So can you share with us a little bit about what Our Minds Matter does with our students in our schools?
Yeah, so as you mentioned, we are a peer-to-peer student-led model. So we are an upstream suicide prevention program. So that means that early on, we want to build these protective and resilience factors in teens and in young people in general, so that they have some skills in their toolbox, such as coping skills, they know where to go for resources, they know how to take care of themselves, so that they can be well in middle school, high school, and beyond.
Right. No, and I know with the MOU that we have with your agency that you are in the majority of our high schools now, and also in 5 or 6 of our middle schools starting this year?
Yeah, so we are in 19 high schools and now 7 middle schools. This is the first year that we're able to widely offer our middle school program. And we're really excited about it because we know that these mental health challenges come up early, even earlier than middle school, so we're glad to be expanding there. And really, there are some differences between our high school and our middle school model. Okay. We like to think of our high school model, it's the students who are in the driver's seat and the club sponsor who is in the passenger seat. So a club sponsor is someone who is a school psychologist, social worker, counselor, and really their role is to oversee the club, to make sure that discussion stays appropriate, that students who need mental health support can get that, and also to be the liaison between the club and the school. And so at our high school model, it's the students who really plan and lead the club meetings and events, and it's the club sponsor who's supporting them to do that. In our middle school model, it is the club sponsor who's in the driver's seat, so they're the ones that have our content, and they're the ones leading these meetings and events, and it's the students who are being active with this content and participating in leadership roles that are suited for their developmental stage. So, for example, there could be a student who's a secretary who makes sure that we take attendance. We've even had roles like a meeting DJ, so someone who creates a playlist to play as students are coming into the meeting.
Oh, wow. So, no, that sounds great. I mean, I really like how developmentally, it's one way for our middle school students, and then for our high school students, it really transitions to help them to build up their leadership skills and actually facilitating the club. Because I know this past Wednesday, we had our virtual student mental health forum, and one of the Our Minds Matter presidents from BCC, Alex, he was our co-host. And so, in talking with him, I think working with Our Minds Matter is really helping in order to build some of those advocacy skills for our students around mental health, and really helping them to find their voice to be able to help in reducing the stigma around mental health.
Yeah, it's been really incredible to see these young people who sometimes they're maybe in 9th, 10th grade, and they take on a leadership role, and then to see them grow into where they're speaking widely about mental health, making real change in their community.
Oh, absolutely. I mean, because trying to reduce the stigma of mental health is a really big focus here in our school district. And so anything that we can do to really try to promote it, as the adults, but even as the kids, if we can get the kids to try to promote this with each other so that kids who feel like I can't get access to mental health services or it's a taboo topic and I don't want to go there, like they have a safe place to be able to go and discuss these things. So that's great. Do you have any information? So let's say a student is watching this and they want to start an Our Minds Matter Club. So what can they do?
So they are welcome to reach out to us. I believe that our website and my email would be provided. If you reach out to us and let us know what school you go to, and if you don't have a club there, we can talk with you about starting that. First, what we're looking for is just to have the go-ahead from your school administration to say, like, yes, we support this. Next would be identifying a club sponsor or more than one to make sure they can oversee the club, and then student leaders identified as well. So if there are any additional high schools in Montgomery County who want to start a club, please reach out to us. And the same with middle schools as we're expanding that program as well.
Great. So we want to thank you for coming on the show today. And I know as folks may be watching in the chat, if they have additional questions for you, I know you'll be back in the Q&A as well.
Absolutely.
So this year, we have kicked off our Mental Health Awareness Week in all of our schools with a special message from our superintendent, Dr. Monifa McKnight, who led all of our students and staff in a collective mindful moment. And so I am now pleased to share a portion of that video with you, and I welcome you to join along from home as well.
Now, I would like to try something unique. I want to conduct a system-wide mindful moment. So all together now, MCPS, let's do a mindful moment for our collective mental health. Sit up straight and clear your mind. I invite you to close your eyes or lower your gaze. Take a deep breath in, thinking about your entire body from toes to your head. Then exhale. As you inhale, breathe deep into your chest, filling it with air. Control the air as it leaves your lungs. Make breathing in and out of your body your only responsibility. Feel the air as it enters and then leaves your body. Do this for about 1 minute. At the end of the meditation, open your eyes. Now that we are a little more relaxed and centered, let's focus on some things we can do this week to care for ourselves, such as exercising, eating well, and exploring offerings at this year's Mental Health Awareness Week. Make it a priority to take care of both your physical and your mental health.
Whew. Wasn't that a great message and exercise to share? Thank you, Dr. McKnight, for bringing that to our MCPS community. Spending time to breathe deeply always helps me to have a more positive focus during my day. And so that video was shown on Monday and then was followed up with a system-wide community circles that took place in all of our classrooms. And so the circles, they gave the students time to learn more about mental health resources, to openly discuss topics, and as always, we want to help to reduce the stigma around mental health. And so next, we will have Tasia Colon Martins, who is an individual and family therapist with Thrive Behavioral Health. So I am so glad to have you here with us today.
Thank you. Thank you for having me.
So can you share with us a little bit about how Thrive Behavioral Health supports our students in our schools?
Yeah, definitely. Well, Thrive Behavioral Health is a mental health services agency, and we provide therapy services, really person-centered services. And what that looks like is providing therapy through telehealth, at schools, and in person. And so we are at multiple schools throughout the county, and what's great is that students can get services as well as parents, family members, and various adults.
And I'm so excited for Thrive because we're actually going to be expanding
Yes.
the amount of services that you are providing within our elementary and middle schools for this year through our new partnership. So, you know,
Yeah.
I'm really glad to be able to have you all on here to talk about, you know, like
Yes.
the expansion and the support that you all will be able to provide and providing these more intensive mental health services to our students in our schools. So, so let's say if you have a school that has been assigned that Thrive will be providing support for, how can somebody go and, let's say it's a parent who wants to sign their child up for therapeutic services through your agency?
Yeah, that's a great question. So if a parent wants a child to come into therapy services with Thrive, and we're at our school, so we're so happy to connect with y'all. There are a couple different ways. You can either go to your school's school counselor, your child's school counselor, and the school counselor will connect the student with Thrive and kind of facilitate that transition to get that process going. Another way is to go to our website, thrivebh.com, and click the referrals tab, and we have a ton of numbers. You'll be connected with the number for our intake coordinator, and we can get the process going like that as well.
Okay. And so, and with this, you know, we want to make sure that our families know that with our agencies that are on here that, you know, we will provide assistance and we'll try to work with you, especially because I know some families are like, well, I can't really afford this. Therapy is expensive. You know, what can we do? And so, in working with your agency and the schools, you know, we want our families to understand as well that we will support them in trying to find a way to make sure that all of our students have equitable access to therapeutic services.
Definitely. That is Thrive's mission to the core, which is why I love Thrive so much, is that there are so many barriers to getting mental health services, which is why I'm so happy that you all are doing your part to kind of put this on a pedestal and really provide the information. And so breaking down those barriers, finding ways to connect people to services, whether that's, you know, with us or with other resources in the community, is the goal. So as long as the person is coming up and willing to get started with services, we will do our best to find a therapist for that person, child, parent, whatever they need.
No, and we appreciate you for coming on, and we know that there may be folks who may have more questions for you later in the show during our Q&A, so we'll be glad to see you back again.
I look forward to it.
For that. So now, before our next guest, and since today is our last day of this very special week, I'm very sad about that, I want to quickly review our highlights from this year's virtual Mental Health Awareness Week. So let's show some of those slides now. So, first off, we had a total of 9 SSL hours that our secondary students could earn for participating in the events this week. 2 of the 9 can be earned for watching this event and completing a brief activity online at the end of today's show. And so in our videos on the Mental Health Awareness Week website illustrate many of the supports for mental health that are available in our schools and the community, and you should check some of those out. We have a range of mental health topics on the website that are available year-round for students, staff, and our families, and some are in multiple languages as well. This year, we created in-person toolkits so that schools could offer in-person activities to help support and promote mental health. Plus, our live events allowed participants to ask the experts and get their questions answered about the resources available and the questions that they may have to support themselves and their family members. And so, my next guest is Kathy Ruano. Kathy is a clinical supervisor with Linkages to Learning. Thank you for being with us today.
Thank you so much for having me.
All right, so can you share with us a little bit about what Linkages to Learning does in our schools?
Absolutely. So Linkages to Learning through Shepherd Pratt actually is in charge of 10 schools. So Linkages to Learning is actually a county-wide program that's divided in different regions, so different community agencies take charge of different regions and schools. Shepherd Pratt has 10 schools, which are primarily in the Gaithersburg area, and most of the schools are elementary schools, so we do have a couple middle schools. So Linkages offers school-based mental health services and social services, which makes it distinct in that we have a team-based approach. So each team has a mental health therapist, a family case manager, and a community school coordinator. So what's really nice about that is we're able to provide services for the child, but also really focus on the family as a whole and provide services, whether it's through basic needs or connecting the family to other community resources. And so our individual, therapists or school mental health therapists are able to offer individual therapy, group therapy, and family therapy within the school day. And what's really great about that is it helps eliminate some of those barriers for parents in reaching services elsewhere. So they can see them in the school, they can offer all these services, and we really want to focus on, that improving overall academic success and emotional well-being. And having the therapist in their school is really nice because they can really collaborate with the teachers and the staff, and so they can provide consultations, they can participate in IEP meetings, they can really help the students and identify, all the needs that they have, not just within mental health. And so, sometimes we get the question of like, well, what are the type of referrals, that you might get? And so we see a variety of concerns, but some common ones are, maybe a history of trauma, anxiety, depression, ADHD. And so if you are, the parent or you're concerned and you'd like to get some help, you can always reach out to the school counselor, who will then be able to submit a referral to the Linkages therapist, and then they will reach out to the family.
All right. Now, that's a lot of support and services that are available, and I'm really happy to hear about, the support that you can provide both with individual therapy, group therapy, and family therapy, because we know that's a really important part, especially with everything that's gone on over the past 2 years. Many of our family members have been struggling, both things that have happened in their communities, things that happen in their household, the economic situations, and family therapy may be a really good option to try to help to solve some of those issues and concerns that have been around for some time.
Absolutely. No, we've seen the benefits of it, and the more you can involve the parents and the family, the more success we see. So whenever we have opportunities to do so, we definitely, invite the families to join.
Oh, absolutely. And and the option for our families to be able to get these services during the school day is also very helpful. As a parent myself, it's like, okay, well, if I can work and they can get these services while at school, because we understand like mental health is just as important as the academic learning. And so, and for many, they need that in order to be able to participate in the classroom setting and be able to receive the instruction that they're getting. So,
Exactly.
because sometimes I get families and they're like, as a school psychologist, like, well, I don't want to take away from the day. And I'm like, well, I get that. But, there are times when they're not able to participate because, like, if they're in this anxious state and they're sitting there like, oh my God, oh my God, oh God, oh my God, and constantly ruminating on different thoughts and they can't focus, they're not learning. If they can go in and get a therapeutic session that can help them get back to the place where they can learn, that's equally as important.
Absolutely, yeah, and we, like I mentioned, we really like to collaborate with the school a lot, and so whatever way that we can, the therapist will be there to work with the teacher, work with the student, work with the parent, so everybody's understanding of what their goals are and what their needs are.
All right, well, we want to thank you for being here on our show and sharing these resources. We know that questions may come up in the YouTube chat, and you'll be around during the Q&A later, so that if families have questions and they want to get them answered. So thank you again for coming on today.
Thank you so much for having me.
All right, and we do want to take some time to highlight some of the in-person activities that our students and staff participated in this week. This is our first year since the pandemic started that we have had in-person activities in all of our schools. These hands-on activities were developed by our newly created toolkits and the ingenuity of our school staff. So let's watch this short photo montage. know about you, but I love seeing all of the variety of activities that the students were engaged in the video. I mean, I was actually there at Shady Grove and I saw that scavenger hunt. I know how much fun the kids had doing that this week. And so next we want to welcome Margaret Braun, who is a therapist with behavioral health and crisis services at the Montgomery County Crisis Center. Thank you for coming on our show.
Thank you for having me. I'm really happy to be here.
We're glad to have you here as well. Can you share with us a little bit about what your agency does?
Sure, we do a lot of things. We're an inclusive crisis center. Everyone is welcome, any age group, lots of issues that we're addressing right now. We have mobile crisis teams to see people in the community when it's not feasible for individuals and families to come into the crisis center. We have our hotline 24 hours a day, 7 days a week. We're open every day, all day long, Christmas, every holiday imaginable, even if it's snowing. So everyone is welcome to come in. We also do mental health assessments of people of all ages. Sometimes we get referrals from MCPS, actually quite frequently.
Yes.
And that's when there's a concern about a student so that they can get some therapeutic support and resources in the community if that's something that is needed for the student. We also work with domestic violence victims to find appropriate shelter and counseling. We also work with the homeless population, single adult male and females, and help get them placed as well and get counseling or whatever they need. So really it's whatever the individual needs at any age, we meet them where they are.
Right.
And everybody has, their unique needs, and we collaborate with them to try to refer them to the most appropriate services in the community. I am one of two clinicians with the CAS program. It's Child and Adolescent Assessment Services, formerly known as SASCA. A parent, the child or teen themselves, or MCPS, or even maybe a community-based psychiatrist or mental health provider can refer a child or adolescent to our program, and they receive a mental health assessment as well as a substance use assessment. So it's both. And then we are very familiar with the programs and community-based resources for mental health and substance use. So we work with the children and the families, and when we have a release with the schools, to find the most appropriate services to really support the student. So we're really excited about that program.
No, absolutely. And so, I mean, it really is important for our family members to know that, in the county, we do have these crisis services that are available for individuals who may be in an immediate need. And you're right, we do make a lot of referrals over to the Crisis Center, especially for our students who may be, for example, having suicidal ideation.
Yes.
And so who make comments about potentially wanting to die. And so we work with our families to make those referrals to you. And glad to hear about the mobile crisis unit as well, who can also potentially go out to the home.
Yes. And I think it's important for kids and their parents to know, since they're some of the audience members today, that we want to help them feel less alone. And we could do phone consultations as well as walk-in appointments with our program, the CAS program. A parent could call and actually schedule an appointment to see April or myself in the CAS program. We can do follow-ups as well. So I want everybody who's watching to know that you're not alone, and we are there 24/7, either by telephone or in person, to provide the very best mental health care possible to you at free of charge.
Right. No,
Okay.
thank you. And that point is particularly important to know.
Yes.
That, the services for this are free. And so
Yes.
for our families, so don't have to worry about, I have to go here and I'm going to have to pay for this support, because when you're in this immediate crisis situation, the last thing you want to think about is, can I afford it? And
That's
so
right.
being able to have those resources provided by the county is great. And so we're really thankful for having you to share this. We know there may be some folks on there who may have questions for you later. So
Sure.
we'll see you later at the Q&A.
Thank you so much for having me, Dr. Chester. I appreciate it.
Thank you for coming on. And so next, we want to show to our audience a resource on our website. It is the Be Well 365 webpage. This website is loaded with all kinds of activities, resources, and information for students, staff, and family. You should go and check it out. And here is the information if you'd like to submit a question in the YouTube chat. We will try to answer as many questions as possible during our Q&A session. And so next, I am pleased to introduce Mr. Ben Stevenson, the Prevention and Harm Reduction Manager of Behavioral Health and Crisis Services with Montgomery County DHHS. Welcome.
All right, thank you for having me, Dr. Chester.
Glad to have you here. Can you share with us some information about the supports that your agency provides?
Right, so I'm here representing our Child and Adolescent Behavioral Health Services, which is located in Rockville and Silver Spring. They have 2 clinics, one that provides outpatient mental health clinical support, as well as community-based services. They're able to provide free mental health screenings, substance use screenings, as well as different supports in regards to referrals to other services and things like that. And then also within our program, we also provide prevention services, which we have a adolescent substance use prevention program, which we have a staff person that's able to go into different schools and provide about 4 sessions of education around coping strategies, around substance use, basic substance use information, mental wellness, as well as just helping kids just to kind of figure out ways to kind of deal with just daily stressors. And then we also have a youth ambassadors program as well, which we started last year. Young people from across the county have signed on to just be a voice for their peers around mental health, around substance use, just advocating just about and educating about the dangers of substance use. And then we also, provide a lot of information through social media and things like that. So we have our Be The One social media platform, which is at MC_B_the_1. Which is on Instagram, and you can follow. There's a lot of wealth of information, one about 988, about substance use and things like that. And then we also provide harm reduction services as well, which we train any and everyone in the county about the dangers of an opioid overdose and how to respond and knowing and recognizing the signs and symptoms. And then we also share a lot of information about safe storage and disposal. So like the safety of storing your medications as well as disposing of those in a proper and safe manner. So upcoming on October the 29th, Saturday, is a drug take-back event, which we're marketing on our knowtheriskmc.org website, where you can find all the locations in Montgomery County to dispose of those medications in a safe manner.
No, and all those things, that was a lot of resources, a lot of support that you all provide information on, and I'm glad to hear about the drug take-back program, because for many of our families, especially those who, maybe have a prescription for opioids and they don't want their other family members to get it, they need a safe place to go and dispose of them.
Yeah, so it's just mainly just hopefully working out a way to eliminate access of those substances and disposing of them in a safe way to prevent them from going back into the water supply. So it just makes it safe, all around when it comes to disposing of those medications. So.
Oh no, absolutely. And I know another thing, program that I believe you all do is the Youth Ambassadors program as well.
Yes, so we do have the Be The One Youth Ambassadors program, which we're currently doing recruitment for. These are youth who basically had the opportunity last year to help develop the entire Be The One social media messaging that was produced by our marketing company, as well as they had the opportunity to present to about 100 young people across the county about, identifying the signs of like depression and anxiety and learning different coping strategies to kind of handle and deal with those different issues. And so they've, really kind of, taken hold of that program, and we really try to empower them to really be the voice and educate their peers, and also just kind of just be advocates for, positive opportunities to kind of belong and things like that. So.
No, that's great. I know for some of our students who are watching in today, especially to get those SSL hours, we want to make sure because I remember you and I also discussed this on our weight making video and talking about the Youth Ambassadors program. So they can also go online and go to our YouTube page and see, get more information around that as well.
Exactly. And if there are any other young people that are interested in becoming youth ambassadors for the county, all they have to do is email us at yap@montgomerycountymd.gov and say, hey, I'm interested in being a youth ambassador, and we'll send them the application. They fill it out, send it back to us, we'll review it, and then hopefully they'll be a part of the ranks of the youth ambassadors.
Absolutely. So it sounds like a great opportunity for our students to participate in some advocacy efforts around the county.
Yep.
So again, I want to thank you for coming on and talking about the different initiatives that you have in your agency. And I know there may be some additional questions that come up later, so we'll see you at the Q&A as well. And so next, unfortunately, our next guest, Luis Cardona with Positive Youth Development, could not be with us today, but I still wanted to share some of that information with you as yet another resource. Positive Youth Development is a part of Montgomery County's Department of Health and Human Services. The program focuses on providing culturally based and healing-informed positive youth development and family strengthening services. Programs include the Street Outreach Network, high school wellness centers, therapeutic recreation, and after-school activities. So please check out their website or reach out to Luis via email or phone. And so we want to thank you again to our panelists for sharing with us today. All of today's panelists will be back in just a minute to answer your questions in the Q&A session. But first, I want you to watch a short news story that MCPS TV produced to kick off, promote, and highlight Mental Health Awareness Week.
Sit up straight and clear your mind. I invite you to close your eyes or lower your gaze. Take a deep breath.
This year, Mental Health Awareness Week was started with a mindful moment from our own superintendent, Dr. McKnight, where she was able to do some deep breathing activities with our students, and then the activity transitioned to community circles. Something new is that we had in-person activities within each of our schools. Activities like Broken Crayons Can Still Color, empathy activities, as well as therapy dogs, and even mental health scavenger hunts that students are participating in their schools.
Does it help you feel less angry? Yeah. Well, there you go. It says walk in someone else's shoes.
To walk in somebody else's shoes, it means to feel what other people are feeling, and to understand why they feel that way.
This week, students can earn up to 9 SSL hours for participating in activities that are being conducted virtually and asynchronously on our website, www.mcpsmentalhealth.org. So this also includes our student Waymaking Mental Health Forum, which is going to take place on October the 12th from 6:30 to 8 p.m. And also our virtual Mental Health Resource Fair, which is going to take place October the 15th from 11:30 to 1 p.m. Check out the website and check out our events and get a chance to participate in all of our activities and videos for Mental Health Awareness Resource Week. That was great coverage, which really highlighted the week, especially the great work that our schools did in bringing fun and engaging mental health activities to our students. That really brought our week to life. So we want to thank you to our schools, the PTAs, our mental health professionals and administrators for making that happen. So now let's get to your questions. And as you can see, all of our panelists are here back on the set to help me address your questions and concerns. There have been a lot of questions coming in, so we might not get to all of them. But if you'd like to submit a question, go to the MCPS TV YouTube channel, join the show, and use the chat feature to the right of the YouTube video window. So let's get started. So our first question that has come in from the YouTube chat is for Catherine Royston. And so can you tell us, so what kind of mental health extracurricular or after-school activities can students get involved with?
So Our Minds Matter Is an after-school extracurricular activity that students can get involved with. We have clubs in 19 high schools and 7 middle schools. So if there's one at your school, you can either reach out to us and we can put you in touch with a club sponsor, or maybe someone at your school who organizes extracurriculars. This is a club that really engages in conversations around mental health, discussion activities, and really building community.
Great. And so, thank you for that. And so then with my next question is, are the MCPS mental health resources only available for MCPS students? And so, and I think with this one, so the resources that are available in the county are available for our students, but also many of them may be available for our staff and for our families as well. But we also know several of the agencies that are here also provide services in the community. So let's say if you're a family member who's watching this and maybe your child goes to a non-public, private, parochial, or is homeschooled, you may be able to contact them separately in order to get a referral for those services as well. And so the next question in our chat is, which schools do Linkages, Thrive, and Jessa serve? So Lainey, let's start with you. Oh, I'm looking really weird, Lainey. Okay, let's start with you, and then we'll go to Tasia and then Kathy.
Sure, thanks. Right now, Jessa is in 17 schools. Those schools are Banneker and Briggs Cheney Middle School in East County, Burtonsville Elementary School, Clopper Mill Elementary School, Crest Haven and Flower Hill Elementary School, John Poole Middle School, Mill Creek Town Elementary, Monocacy and Poolesville Elementary Schools, Poolesville High School, Redland Middle School, Richard Montgomery High School, Rocky Hill Middle School, Roscoe Nix, Sequoia, and Stoughton Farms Elementary.
All right, so.
Thank you. And so Thrive, we are just starting our partnership with MCPS, which is amazing because we'll be able to be set up and partnered with more schools. We are at various schools throughout Montgomery County, which is great. But really with Thrive, we are, it's client-centered, so we look to the student and see where they're going to school first throughout the county, but we'll be able to list more specific schools once we get those elementary and middle school partnerships set up. But really, wherever your kid goes to school in Montgomery County is where, if you want to do school-based therapy, is where we'll see you.
All right, and so Kathy.
Yes, and for Linkages, we have 10 schools. So we are at Gaithersburg Elementary, Gaithersburg Middle School, Summit Hall Elementary, Maryvale Elementary, South Lake, Rosemont, Harriet Tubman, and did I say Summit Hall? I believe. Mm-hmm. Yeah. I think that was it. So, but please visit our website. All our schools are there. And like I mentioned earlier, we also have schools around the county. So our Linkages website will also be able to list out the rest of the schools in the county.
All right, thank you. Our next question is, so what is the best way to balance everything so we don't stress out at all and can have a fair schedule? So, Ben, I'm going to throw this one to you. So, I think this comes from one of our students.
Okay, thank you for that question. I'm probably very bad at balancing sometimes, but that's just a part of life, you know, so it's just really about, sometimes it kind of goes back to time management, you know, keeping a schedule, which is something that I do, and building some of those moments of just self-time for yourself into your schedule, whether it's, you know, exercising or reading a book or journaling or, you know, doing something that kind of, you know, makes you feel good about yourself or kind of lifts you up. So just embedding those types of things in your schedule, and then just, you know, not taking on too much. I think sometimes we do that, and so just making sure you don't take on too much, and just try your best to stay as balanced as possible. But it's normal to get out of whack sometimes.
Oh, absolutely. I know as adults, we feel like that too. So like if you're a kid on here watching, you're like, oh my goodness, like, unfortunately, I can't say that it ends as you get older, but hopefully as in time, you learn better ways to cope with it, right?
Cope with it and, yeah, manage. Mm-hmm.
Oh, absolutely, absolutely. So, and so the next question, I know for our partners, so do your therapists come to the school, or do we have to go to your agency? And so, Lainey, you want to start?
Sure. So our therapists are in those 17 schools that I listed, and if you have a child in one of those schools, you'll be able to connect to our services that way. We do have an outpatient mental health clinic that's located in Rockville where we can see families and individuals, and sometimes our therapists also will set up family sessions. So that's something else that we can offer if that's what your family. And we work virtually, so we're able to see people in all those settings.
All right. So Tasia, you want to go next?
So similarly, we are also telehealth. So we do telehealth. We go to the schools and provide therapy in the schools. We also do, on a case-by-case basis, we do also provide in the community services. So taking a walk in the park and talking about therapy and your goals and things like that is also an option. Really, it depends on where the client wants to feel comfortable providing therapy, as long as it's a safe and private space. But it really depends. It could also be in our office as well. So there are a ton of options.
All right. Margaret, you want to go next?
Sure. So we see the children in the crisis center. If someone has a referral from their school, they do not need an appointment. They can walk right in. If a child is struggling with substance use, however, it's always better to call and ask for the CAS clinician so we can make sure we're going to be there and see you at a time that's most convenient for you and your parent. We also have the hotline. Children and adolescents can call in and talk things out. They can ask for the CAS clinician, April Williams or myself, Margaret Braun. Or our supervisor, Pamela Saunders. She's a social worker there as well. But we also can do mobile crisis. Sometimes it's not feasible to come in to the center, or maybe someone's hesitant to come in. There's many reasons why people don't want to come into the center. So you can call in and talk to anyone at the crisis center and explain your individual circumstance, whether you're the person struggling or it's your child or another family member, and they will help guide you about whether mobile crisis is, the most appropriate response to that crisis. I don't like to, have a blanket statement because everyone's different and their circumstances are different. So we really meet people where they are, and we really focus on what it is would be the best possible way to provide the support that they need during a crisis.
Oh, thank you.
Okay.
Kathy, you want to go next?
Yes, so similar, we do provide all our services in school, so the therapist would be able to see the students during the school day. If it so happens in the summertime or evenings, our therapists can also offer virtual or meet the students in the community as well.
All right. Another question from our YouTube chat is, so what can we do to become or stay mentally healthy? So Rachel, I'm going to throw that one to you.
That is a fantastic question. I think it's something we all need to work on throughout our lives. But I think finding a way to cope that works for you. So meditation might work for your friends, and exercise may work for your siblings, but you got to find what works for you, something that's going to be easy and that you're actually going to use. And it's also, if the first thing you try doesn't work, try something else. There's a million things out there. You can learn to bake, you can do art, you can, game online. Anything that's going to give you like an ability to catch your breath and sort of reset. Find what works for you and don't give up until you do.
Oh, absolutely, absolutely. And so, and I also want to throw that also to Ben to see, if you have anything else you may want to share with that.
Just to piggyback off of what Rachel said, I would just say, just make sure you put multiple things in your toolbox. It's really important to have various activities or different things you like to do to really, help you kind of cope and deal with things. So making sure you have those in your back pocket, whether, you might want to do some art and the art might not turn out the way you want it to, but hey, you like to do something else that, hey, it did turn out, well. So just making sure you have multiple things in your toolbox.
All right. And then also for Catherine, because I know like you all cover some of this in the Our Minds Matter Club in your lessons. So what are some things that students learn about staying mentally healthy, in the clubs?
Yeah, so I think something is that we talk about checking in with yourself on a regular basis to think, okay, like what I need right now might not be what I needed a week ago, and to reach out for support. Like we have communities, whether that's friends, family, and maybe if you don't have someone to talk to, there are a bunch of resources that you can call, even if you're not in a crisis, to just talk to someone. So like check in with yourself. Ask yourself what you need, and try to prioritize that in yourself and your mental health.
All right, well, thank you. And so one of the questions that has come in is therapy provided in the summer when school is out? So going back to our agency, so Kathy, what's the answer to that one for linkages?
Good question. Yes, we offer services year-round. So in the summer, it'll look a little bit different, but we are in the schools still in the summer. They're still open, so parents can bring their children in for their sessions, or again, we can offer virtual, or we can go into the community or their homes to see the students if needed.
All right. So Tasia and Lonnie.
Yes, that's the same for Jessa. We were able to provide continuity year-round. That even means Christmas break or other times during the year that students might be out of school. If they would like to continue services, they would arrange that, and we were able to keep seeing them and keep providing that support.
Yep, and right along with you too, same. We offer year-round services, so you can be seen in the summer at our clinic or in the community as well. Schools are also, like you said, open in the summer, which provides a familiar and safe space as well for the summertime. And of course, the summer can get very busy with vacations and trips and things like that. So I know parents get super busy doing one thing and another. So if you need to switch up and do telehealth one week and do office visits the next, that's definitely possible.
All right. And so a question came in, so what can you do if someone can't afford therapy and the school counselor is busy? So I guess going back to our agencies again, what can they do if they can't afford therapy in our schools? Do you want to start back again?
Yeah, definitely. So that is definitely a barrier for a lot of families. But what's great is that with Thrive, we really work with individuals and families to provide that therapy service. And so our intake coordinators definitely go through monitoring what insurances, whether it's Medicaid or private insurance, the person has or the child has, and see which therapist can be best matched with that, because we want to make sure to get services regardless of what their need is.
Okay. And so, and I know Kathy, do you want to go?
Yeah, so for linkages, we don't deny services for any student, regardless of financial means or lack of insurance. So yes, they would just talk to the therapist, and we would make sure to address any needs. And if for whatever reason, we couldn't do that, we would make sure to connect them to other resources in the area.
All right. All right. And so then my next question is, says that we have lost 2 family members recently, and it's been really hard. What support can I get for my child? And so I'm going to just throw it out because I think that multiple of you may be able to answer that one. So let's see. So Rachel, do you want to start with that one, and then we can wrap ourselves around?
Well, there are lots of resources in the community, and if you call 988, we'll get you connected. I know that the Crisis Center has a lot of great stuff as well. But I think the important thing is to talk about it, and to, don't be afraid to talk about it with your children and with your family. I think a lot of people are afraid they're going to make it worse, but don't hesitate, because that's how you get the emotions out. And grief is different for everybody. It looks different, and don't get upset if people aren't processing the same way that you are. And know that 988 is always a resource 24/7. You can call, text, or chat about what you're going through, and we can connect you to those resources. But I know that the county has some great stuff as well.
Yes, we do. Hi.
I'm really glad someone asked that question. That's sometimes a hard question to ask. There's a lot of emotional pain with loss. And what the Crisis Center does is, of course, they could walk in and see a clinician, specifically the child. But there's also another added benefit is if the parent wants to call the Crisis Center and discuss their particular situation, and she wants the entire family to receive grief counseling in the home, the mobile crisis team does that. We actually do critical incidents in the community when there's a sudden death or loss of a loved one, and we go out in the community on mobile crisis. We have 3 locations where we are immediately available for the grief and bereavement counseling, but we also refer to many different support programs in the county. A lot of them are free of charge. Once we have an initial visit with them, either in their home or at the Crisis Center, I just ask the parent to please call in to make the arrangement that works best for her.
Okay. Well, thank you. Thank you for that information. And so another question has come in from the chat. Are there services for students and adults who do not speak English? And so I know several of you may be able to answer that. So if you just want to raise your hand real quick, I can call on you so you can go and answer. So, all right. So, Tasia.
Yeah, definitely. So Thrive has a very culturally diverse team, and we have a lot of clinicians who have Spanish-speaking skills, and that's one of the best way, I mean, myself included. So it's really great to connect with families and provide services in a language that's familiar to them. And so whether that's talking to them about their child or speaking with them directly, that's one way to connect and provide therapy services that is most comfortable and safest for them. So we do have clinicians that speak Spanish at our agency, and that is just a great big population in Montgomery County, and we love to be a service to them.
Anyone else? Oh, Rachel.
Yes, 988 has lots of language capabilities. We actually have a Spanish sub-network for folks. And I also want to point out that we have specialized services for the LGBTQIA community as well on all 3 services. So if that's something that you want to talk about or focus on, we can provide that as well.
Great.
I just want to mention we use the language line, and we have bilingual counselors at the Crisis Center. We just want to reiterate that everyone is welcome, and no matter what language you speak, we are going to talk to you and we are going to help you.
Awesome. Oh, Ben, go ahead.
I was just going to add that Child and Adolescent Behavioral Health Services does have bilingual therapists as well, located in their Rockville office as well as the Silver Spring office, and they can do in-person and telehealth as well.
All right. All right. So then next question. So what is the difference between antisocial behavior and social anxiety? I don't know who may want to come and throw that out there. Like maybe some of our clinicians be able to provide some insight in terms of antisocial behavior versus just regular like school or social anxiety that may occur. Anybody here? No? Okay, go ahead.
Sure. Those are actually, they sound similar in terms, but they're actually very different concepts in the mental health field. So antisocial behavior is things that kind of goes against social norms, things that kind of go against like what you would expect and what would be, normal in that society or that culture, as opposed to social anxiety, which is about having anxiety about being in social situations. And social anxiety is something that's much more common in our kids, especially when we had kids coming back from virtual learning, just being back in the mix of a busy school building. We had a number of children that were really struggling. And so therapists are able to help process those feelings of social anxiety and help them adjust to the school.
Thank you for the explanation. Now, also in here in the chat, we have, there are several questions in there about school psychologists, so I have to answer those. And so how do I find out who they are and when are they in the schools? And so we do have school psychologists that are assigned to all of our schools. They are predominantly not there 5 days a week, except for some of our high schools may have psychologists there every day of the week. But you can talk with your administrators, go down to your counseling suite. The counseling secretary should know when your school psychologist is going to be in the building providing support. You can also email them and get they're contacted with them, so you can schedule an appointment if you want to speak with the school psychologist. We do have a psychological services website on the MCPS webpage, and also the Be Well 365 website, which you saw earlier, has an access link to the school name, and then it'll show you like who are all the mental health professionals that are assigned to your building. And so on there, you can get a chance to see like who they are. And then you can talk to the folks in the school and email them to see when are they available to provide services. And school psychologists, they're there to provide support for students who need support when it comes to assessments. So let's say if you need assessment for special education, you need an assessment for a 504 plan, maybe you need a diagnosis. They also provide both consultation to families, to teachers around academics and behavior, and also counseling in our schools. And so they are trained in a number of therapeutic models like individual therapy, providing cognitive behavioral therapy, solution-focused therapy. Depending on the psychologist and where they went to school, they're trained in all these different things. And so I can talk about different things I've been trained in, but I'm not doing therapy anymore. But when working with them, and we continue to provide support for them for that, especially for those schools that don't have an agency that's assigned to them. Although we're always trying to expand that option for all of our folks. I'm sitting here looking at you all like, we're always trying to expand. So, all right. So on here, another question is, how do you have better time management, and how can I learn to focus better in class? And so Ben, I'm going to throw that one.
I guess for that, focusing in class can be a challenge when there might be a lot of different things going on within class. So my suggestion for that, which is something I employed when I was in school, is trying to sit as close to the front as possible. It helps to kind of tune out, what else might be going on in class, but it also helps you to be a little bit more participatory within the class, because you're kind of engaged in what's going on, and hopefully, your teacher is engaging and uplifting and things like that. So I guess that would be my suggestion in regards to focusing more in class.
All right. Anyone else want to? Rachel?
Sometimes it's really hard to focus when you have a lot on your mind and a lot on your plate. So it can be really helpful to sort of process some of your emotions. If you're really anxious or stressed about the school play that's coming up, or if you're really upset because maybe there's a loss in your family, that can make it really hard to focus on your schoolwork and on other activities. So taking the time to process it, having that conversation with the school counselor or 988 or any of the resources that are available can help you sort of deal with that and then be able to refocus on what you need to do. But it can be really hard, so we have to take care of ourselves so that we can do that.
Oh, absolutely. And so another question from the chat, this one's from Margaret. Does the MCPS Crisis Center have an online chat? Maybe not, but
No, we do not.
all right.
So it's traditionally just calling in and talking to someone.
All right, but I know 988 has a chat function, so which is good.
Yes.
So, all right, but at least we were able to answer that question as it comes in. And so this is probably for almost everybody here. So if someone is depressed, what should somebody do in order to help them out? So anybody want to raise their hand and answer that one? So if you have a student, you have a friend who's depressed, what can they do in order to provide support for them? Go ahead.
Well, the first thing we'd want to do is assess them for clinical depression. Sometimes if someone has been in a deep depression for a while, then you'd want to have them meet with somebody for medication management. But if it's just someone in your life and you're worried and it's kind of new, then a really important thing is keeping them socially connected. So in any way possible, in any way that they're open with, just to try to keep them socially connected and outside. Getting sunshine is very important as well.
Oh, go ahead, Catherine.
I'd also say that you all, or young people, are teens, you're students, you have a lot on your plate, and you're not mental health professionals, so it's not your job to be, advising or counseling your friend. If you see a friend who is struggling, reach out to a trusted adult. Get someone else in the loop who can provide support. Something we often promote for our clubs is the Be There certificate, which is created by the Born This Way Foundation and Jack.org. And it teaches really anyone, but especially teens, to identify the signs in their friends that they might be struggling and what to do. So it's a free online tool, very interactive. I took it myself and really enjoyed it. And so that's a great way to learn how to support a friend or a loved one who may be struggling.
Anyone else? No? Okay.
I just wanted to piggyback. I liked what both of you said, but I think when people feel depressed, they feel very much alone. And I think this is a student asking a question, and they're not mental health professionals, but being a good friend is being a good listener, and thanking your friend for having the courage to share, because depression makes you feel very much alone. And just getting it out to someone, even if it's a peer, is a huge step towards wellness in accessing the help that you need. So be encouraging, thank them for sharing, and go to a trusted adult who can find the resources for encourage them to go to a trusted adult so that they can get the help that they need, because you can't solve that problem for them. A lot of kids come and say, I don't know what to do. I feel so bad. I want to help them. And they think they can help solve that problem for their friend. That is not their job. They're children and adolescents. It is not your job to solve that problem. Encourage them to go to the trusted adult to get the resources and the support they need.
Oh, thank you for that. And yes, it is important for our students to, know where can they go. And you hear that as a big theme throughout the day is, if you as a student have a friend who is struggling, go find that trusted adult. And we try to teach that through our Signs of Suicide Prevention program in our secondary schools as well. But we just want to make sure to always reiterate that how are we trying to provide that support to our students to help them to know that, you don't have to do this alone, and that there are a lot of adults in the building who can help you through this. And even if that trusted adult is someone in your community, is somebody in your family, talk to somebody. Just don't feel like I have to solve this by myself. So that's a very, very important theme for today. And so a question has come up in the chat. This one's for Ben. What is a youth ambassador, and how do I get involved in the program?
Oh, great. Thank you for asking that question. So a youth ambassador is basically a young person within Montgomery County that is eager to learn more about mental health, about mental wellness, about substance use prevention. And basically what we do as the adults, we just kind of empower them to kind of be the voice of those issues that young people are dealing with. And what we do is we train them up in different leadership skills. We provide them education about basic substance use, about mental health, about mental wellness. We talk about coping strategies, and we train the young person up to actually be ambassadors within the community so that they can train and educate their peers about those different issues and those different topics. We provide opportunities for outreach and advocacy within Montgomery County. So if a youth ambassador is interested in hosting like a resource table at their school, we'll help them, kind of put that together so they can educate their peers maybe during lunch or something like that, or if they want to do something during a football game or wherever they would like to do it, but we're just kind of there to just support them. So if a young person is interested in being a youth ambassador, all they have to do is email us at yap@montgomerycountymd.gov. And then once they express their interest, we'll send them the application to apply. And once they apply, then, hopefully we can get them in the ranks of being a youth ambassador. Typically, youth ambassadors hang on for about a year. We had about 11 last year who 7 out of those 11 ended up wanting to come back this year, and we had a little over 25 applied this year. So hopefully it's growing. Eventually we hope to be to like 100 students that want to be youth ambassadors, because the goal is to, provide them opportunities to, attend national conferences and learn from peers across the country on how to do that kind of work in their own community. So.
Yeah, absolutely. So for all of our students watching, here's your opportunity if you want to come and sign up.
And you can get SSL hours working with us.
And SSL hours. There you go. Okay, I know that's an important part for many of our students. And so someone also asked, and I'll throw this out to especially our agencies that work in elementary schools, is it possible to help younger children, elementary school and below, with mental health services? So, Kathy, you want to start?
Yes, absolutely. No, thank you for that question. Yes, so within linkages, we see students from K through 5, and so we are able to support all the ages. And, I think in the beginning, sometimes parents, might be unsure if this is something that is a concern, or is it, appropriate? Is it developmentally something that we see? So what we really ask is you talk to your counselor, you talk to your therapist, ask those questions, and we'll be able to support and let you know, is this something that would be a good to do individual therapy? Would we need family therapy? Sometimes the younger they are, or most of the time I will say, we definitely involve the family, because we know how important it will be to have the parents be a part of the process.
All right. So go ahead, Tasia.
Definitely. So yeah, it looks different for sure for therapy services for younger kids, but it is so important. All of our Thrive therapists are trained in various different treatment modalities. So for the younger ones, play therapy is so key because they're playing, they're having fun. But even with my own clients, the amount that these kids are learning and seeing and processing, it's still the same as us. It just comes out a little bit differently. So play therapy as well as mind-body connection, why do my hands ball up or get angry? So these are definitely important for them to start learning at a younger age, and then just start building as they get older.
All right. So you want to go?
We also serve students in kindergarten to 8th grade, and at the moment a few high schoolers. But those younger students, one of the things that we can really be helpful for them is helping them identify their emotions. Often they have these big feelings, but they don't have words for them, and they don't have a way to describe them, so they're not really sure what to do with that feeling. And so just being able to name it and understand it a little better, and then developing some good coping skills. So that might just be breathing regulation, just other things that they can do to kind of calm their body down and be able to manage those big feelings as they come out.
Right. And I also want to make sure our audience knows, so for those families who have preschool students, especially if you're in a preschool, like a Head Start program or a PEP program in Montgomery County, we do have mental health staff that are in those programs, and they can help you in providing mental health support to those students as well. I know as a former preschool psychologist, as Tasia said, I provided lots of play therapy to kids at that age, and yes, you can provide mental health support to students of all ages. And so we just want to make sure that our families know that we do have support pre-K to 12 to provide mental health services to our students of all ages. All right, and so going in here, next question. So what is the best way to balance personal life and schedules for school or extracurricular activities? So, Catherine, you want to start?
I'll take that, yeah. I think this goes back to the time management that has become a theme. I'll speak from my experience. Personally, I have come to the point to realize you can't do everything, and you have to pick the things that are important to you and work on prioritizing them. So I'd say that especially having grown up in this area, I know the pressure of wanting to do it all and be good at sports and music and school. And so I'd say really picking the things that are important to you, making time for them, and also knowing that like because you prioritize those and yourself and your mental health, that there's other things that maybe you're not going to be as good at, maybe you're not going to be able to do, and that's okay. I'll also say that rest is really important. Rest is actually really productive, and we need that for ourselves and our bodies and our minds. And so incorporating rest into your schedule, into one of those priorities is also really important.
All right. No, thank you. And there's a question in the chat that says, if you talk to the counselor about something, does it go on your permanent record? So I'll answer that one and say no. So information that's shared with the mental health clinicians here in the agencies and in the schools is confidential. And so no, this information does not go on your permanent record. It is not something that is shared. No, sometimes students are like, well, I can't talk to my counselor because I'm afraid that it's gonna, colleges, when I apply, they're gonna see these things. They're not, because it doesn't go on your permanent record. And so this is confidential information, and that we just wanna make sure, because our students know, because we don't want it to be a barrier for going and seeking out mental health support, because their fear that the information that is being shared is going to get out. And so no, that information is not shared. They did not put that information in your recommendation letters to college either. And so we just want to make sure to clarify, because that's a big rumor that's throughout the county, and I hear this for all the time from our students. And so no, information shared with your counselor, especially around mental health, does not go on your permanent record. So I want to clear the air, clear that out there right now so people understand. All right, and so this was asked multiple times. How can I stop procrastinating and not zoning out in classes? So does anybody, because that's a common thing I know we hear with a lot of our students in our school. So Tasia, you want to start?
Yeah, definitely. School day is long. You start early in the morning, and it goes all the way till the afternoon. So everyone is different, but a lot of my clients, and from what I see, using your body and actually, speaking up and saying, hey, ex-teacher, I need to go take a walk for a little bit, and just taking a walk and kind of changing up your environment, or ask your teacher if you can go to the back of the classroom and maybe do 5 jumping jacks, or use a stress ball or fidget spinners. I know there's a ton out there, but doing something to kind of loosen up, shake up, and get back to focusing, but definitely taking like little mini mental breaks.
All right. And so just really quickly, because I know we're almost out of time, a question came in. So what if I know that someone is planning suicide? I'm going to throw that over to Rachel real quick.
Well, like we said earlier around depression, you don't have to handle it alone, right? So let the person know that you care, that you're concerned. Thank them, like she said, thank them for sharing that with you. It's a very brave thing to share that. Reach out to 988, but also get that person connected to a trusted adult, because suicide is something that, it takes a lot, and nobody should carry that on their own. So, please reach out, get that person connected, but also be there for them as well.
All right. And I know, and since we are nearly out of time, here is one final question. So what kind of problems do each of your groups work on? And so we'll go around. So Kathy, we'll start with you, and then we'll go around the room. Just one real quickly, 5 seconds.
Yes. So we have we cover a variety of things. Some common pieces are trauma, anxiety, depression, ADHD, behavior modification, grief. The list goes on and on, but we're very open to a variety of problems.
I don't have an hour. I'm saying the same as her, but we also work with people who are in need of shelter placement, as well as critical incidents, mental health, substance use, domestic violence, you name it. Just call in and ask for help, okay? 24/7.
Same, everything, and you don't even have to have a diagnosis. You don't, you don't have to be suicidal. You just need to talk. We're there for you.
We're pretty much the same as well. I know as far as child and adolescent behavioral health. They pretty much address anything under the sun related to mental health and substance use. And then I do a lot of the prevention work and harm reduction work. So if you're fearful of somebody who is dealing with like opioid use or something like that, we can provide Narcan training in a kit or fentanyl test strips or something like that just to help support you in that person. So.
And we also can cover the whole spectrum, but a few things that come up are just being able to manage those big emotions, being able to name them, and helping with communication, because often that can really help both the kids and families.
Our Minds Matter focuses on building connection, knowing about resources, coping skills, and how to take care of yourself.
Similarly, like everyone else has said, a lot of different things from anxiety, depression, trauma, but a lot of things, sometimes you don't even have a name for things, or sometimes there are multiple things going on at once. So the evaluation when you come see Thrive really helps make your treatment plan individualized to you.
All right. And so, a huge thank you to all of our panelists for being with us today. Your perspectives and experience have been so valuable. And so, I really want to remind folks about the additional resources that are available for families on these topics. They are all available on our Mental Health Awareness Week website. And students, don't forget about those SSL hours, which you can earn by watching today's program or the videos on the website with SSL next to them. Then you can just do a short reflection and submit an SSL form. And please take a minute to fill out the evaluation and the survey. It means a lot to us, and it helps us to plan for future offerings and events. And again, I want to thank the Montgomery County School Psychologists Association, my staff, and all the people behind the scenes in well-being, learning, and achievement, the School District Medical Officer Office, Communications, MCPS TV, MCC PTA, Our Minds Matter, and our panelists for your time today. And we want to thank our viewers for joining us for our virtual Mental Health Awareness Week resource fair. Be well, be aware, take care, and bye-bye.